Hello, my name is Mark FitzGerald. I'm a respiratory physician at the Lung Centre at Vancouver General Hospital and also a professor of respiratory medicine at the University of British Columbia. Today we're going to help you develop an action plan to manage worsening of your COPD. This action plan will be developed by yourself, helped by your family physician or other specialist. You should follow this video along, but also it may be helpful to watch it a second time so you pick up the important messages that it contains. COPD flare-ups happen when symptoms get worse. Usually they get worse over a number of days, but they also may deteriorate quite quickly. It's therefore important to discuss with your family physician the best strategy in terms of monitoring your symptoms and when to intervene. An action plan will help you make decisions when your symptoms get worse, but it's very important to realize that if you take your usual COPD medications regularly, this is the best way to prevent an exacerbation. In addition, having an annual flu shot and also getting your pneumonia shot updated every 5 to 10 years will be helpful in preventing an exacerbation. Although the risk is lower when you take your medications regularly and also get your immunizations, it's important to realize that you still are at risk of developing a COPD exacerbation. To recognize a flare-up or an exacerbation, it's important to know what your usual symptoms are. These symptoms will usually be coughing, producing sputum, feeling short of breath, being limited in terms of your activities of daily living. Knowing these baseline symptoms will help you in putting together an action plan with your healthcare provider. An important consideration when you're monitoring your cough and sputum production is that many patients with COPD will have these chronically. Important things to recognize though is if the volume of sputum increases or if the color changes, and these are signs that your COPD may be getting out of control. So when you start experiencing more cough, more sputum production, and a change in color, you may begin to be experiencing a COPD exacerbation or flare-up. Once you've seen these signs, you now know that you need to consider adjusting your treatment. If these symptoms persist for more than 48 hours, we generally understand that you're experiencing a flare-up or an exacerbation. The following slide will show you the sequence of events and also tell you how you should respond. The initial approach will be for you to increase the use of your regular reliever medication, usually salbutamol, Ventolin, or the Atrovent. Both of these inhalers are what we call reliever medications, and they will give you immediate symptomatic relief. If you continue to be symptomatic despite these medications, and especially if your sputum is yellow or green, you may need to start antibiotics. And in addition, if you are short of breath, you may also need to start a short course of prednisone. Your family physician or educator will have explained to you about the correct time to begin these treatments. Once you've begun your action plan, it's important that you make a follow-up appointment with your family physician so that you can review the approach that you've taken and whether it has been successful. Prior to you having an action plan, it's important to work with your family physician and get a prescription from him or her to provide you with antibiotics and a course of prednisone. You may decide to leave this prescription at the pharmacy or fill the prescription and have the medications at home, which may be more convenient, especially if an exacerbation occurs over the weekend or it develops rapidly. In most cases, when one starts a course of antibiotics and prednisone promptly, the exacerbation or flare-up in symptoms will settle. But it's very important to know that in some patients, the effective treatment will not be helpful and you will need to go to the emergency room. If you do feel very short of breath or if your symptoms are worsening, you should therefore not be afraid to call an ambulance and get to the emergency room. So in summary, we outline on the slide you're now seeing the different approaches that one needs to take. You should be aware of your baseline symptoms, particularly in terms of the amount of cough and sputum production and the color of your sputum. You should also be aware of your usual level of shortness of breath. If there's any change in these, in particular an increase in shortness of breath, fever, or a change in color of your sputum, you may be experiencing an exacerbation or flare-up and should begin by using your rescue medication. If the rescue medication is not effective or if your symptoms deteriorate within the first 48 hours, you now know that you should also start prednisone and antibiotics. You should also be aware that if you have a more severe attack, you should not be afraid to call an ambulance. More information with regard to your action plan and also additional information with regard to your medications will follow at the end of this video.